All right, I think we'll get going, and I want to thank everybody who has taken their time to attend our webinar, and I also want to thank our panelists for offering up their time and their expertise. And the panelists are friends of the agency, but they might say, Jim, if we're friends of the agency, why are you putting us on the hot seat today to talk about innovative strategies for this year's Medicare AEP? But we appreciate your input and the insights that you'll provide to us today. Before we get into the question and answer, I thought it would be helpful. I know there's some folks that are on the webinar that don't know who Merge is, so I thought I'd spend a couple minutes on that before we start, and then we'll get right into question and answer. So, I'm in Boston, but we're in 7 or 8 different cities throughout the country, and we have between 700 and 800 folks that work for us around the country. And we like to say at Merge that we merge storytelling and technology in order to bring health, wealth, and happiness to the lives of consumers. And that health piece is about 70% of what we do. We have a robust life science practice, and we work with a lot of pharma companies in areas like cancer treatment and diabetes. And we also work with about 20 different hospitals and health systems throughout the country. So that's a big part of what we do. And then lastly, we work with 17 different health plans throughout the country, and I oversee the health plan practice, and plans that are blue, that are non-blue, that are big, that are small, that we work in commercial, and also obviously in the Medicare segment. And this is what we do for them. We're soup to nuts. On the storytelling side, we have a wide range of strategy services, anywhere from research to customer insights, brand planning, journey mapping. We do a ton of creative, obviously, as an advertising agency, CX experience, strategy, and design. And on the technology side, we do media analytics. We do all types of performance marketing, email, SMS, SEO, content marketing, and analytics associated with that. And then we do a lot in the area of development and platforms, CMS implementation, CRM implementation. We work across a wide variety of platforms, but here are some of the platforms that we kind of work mostly in: Sitecore, Marketo, Domo, Salesforce, Adobe. And so with that, I want to get to our panelists. I've already introduced myself, Jim Porter, oversee the health plan practice. And I thought we would start with, why don't we start with Adam?
Thanks, Jim. Good afternoon, everyone. My name is Adam Burton. I'm an experienced marketer who's worked on both the ad agency and client sides. I've been involved in marketing MediSupp, MA, and D-SNP plans nationally, regionally, and locally, and have done so for both payers and providers. I've led teams responsible for brand, acquisition, engagement, and retention. While at Optum Care, I was charged with attracting Medicare Advantage patients for clinicians. I led senior product marketing at Point 32 Health, which is the merger between Tufts Health Plan and Harvard Pilgrim. And I ran the United Healthcare ARP Medicare account agency side. I'm excited to participate today and would like to thank Merge for having me.
Thanks, Adam. Next, I'll turn it over to Michelle. And Michelle wants to make sure that her cat doesn't come in the screen, but if we do see the cat during the webinar, that's okay.
Yes.
That's just working from home. Michelle.
Yes. Hi, everybody. Happy to be here. So I am Michelle Boudreau, a SVP account group lead here at Merge based in Boston. And my career has been exclusively healthcare and spanning the spectrum from the discovery of therapeutics and the diagnostics, marketing of the diagnostics, to hospital systems, to focusing exclusively on health plans for the last 7 years now. And that's working with a variety of regional plans spanning Medicaid, Medicare, including D-SNP, Supp, and I'd say, traditional Medicare Advantage and working on brand campaigns as well. So very happy to be here, and I will turn it over to Len.
Good afternoon. I'm Len Cudgis. I'm the Chief Operating Officer for HealthShare 360. HealthShare 360 is a Medicare company, a consulting agency that works with both providers and carriers. We specialize in helping our clients optimize their Medicare market share, their revenue, and their wallet share. We're also a full service provider insurance agency. So kind of think of it at the broker side of business, right? Before I went to HealthShare 360, I also worked for a mighty long time at Horizon Blue Cross Blue Shield, New Jersey. The last thing I worked on when I was at Horizon was their Medicare Advantage joint venture between Hackensack Meridian Health and Robert Wood Johnson Barnabas Health. It's called Braven Health, and it's been the fastest growing MA plan in New Jersey for the past 3 years. So I bring to the webinars both some broker and some carrier side of business.
Okay, thanks, Len, and thanks everybody. So I'll take it out of screen show mode. Here we go. So, and I think we're going to last about 40 minutes or so, approximately, and I'll ask questions, and I'll probably direct questions to certain folks, but after that person has addressed the question, the rest of the panel feel free to chime in with your perspective, or we can move on to the next question. That sound like a plan?
It does.
So I'll start off with you, Michelle, and just kind of big picture standpoint, talking about Medicare as a whole. If you can, and we'll drill down as we talk in the webinar about specific strategies and specifics within Medicare and Medicare Advantage, but just can you talk kind of broadly about what Medicare means in the lives of seniors? And we know, for example, that whenever any politician, left or right or whatever, starts talking about screwing with Medicare, that people go nuts, right? Because this is something that they feel like they're entitled to and they worked for all their life. But give me your perspective, if you could, Michelle, on Medicare and seniors' lives.
Sure. So Medicare is something that is very important to seniors. Research has shown that the number one ingredient, or seniors say the number one ingredient for happiness, is good health. And picking the right health plan is a big part of that. And especially when you think about Medicare Advantage and the role that that plays in working to help keep you in your best health, and what that means for how you feel and your ability to fulfill your goals for your retirement. Also, when you're feeling good, you're able to be active and connected with friends and family and your community, and that can help stave off isolation and loneliness. And the other side of why Medicare, the right health insurance plan, is so important is the financial security. And being on a fixed income, you're looking to keep your cost of living low. You're looking to avoid unexpected costs. And Medicare Advantage helps that. One, you can predict your costs pretty well. And two, you have a sense of security that there's not going to be a significant medical event that's really going to chip away at your savings and become kind of a threat to living the ideal lifestyle for the length of your retirement. Also, the satisfaction levels with Medicare Advantage. I'm seeing stats as high as 98%, and even at the low end, we're talking the high 80s. So how many things in life have satisfaction levels that high?
Right. Good points. Adam, Len, anything you want to add to that?
I would just add that, I think, Michelle, you've hit on the right points, especially from a financial perspective. And in today's environment, that's only heightened with inflation and recession concerns, right? So that really hits home for people as well, making Medicare Advantage all the more important and finding the right plan to ensure they have the care and coverage that they need.
Great point.
The other thing I'll add is that during COVID, right, which now is a couple of years ago, having the right Medicare plan for seniors was very important, right? We wanted to make sure. I know when I was with a carrier, you had a whole social isolation thing going on, right? So you wanted to make sure that consumers, seniors, your members were being cared for during a very unprecedented time. So everything Michelle hit on was really important, but there's other factors too that go into it. Like, what is your plan going to be there for you when you need them the most, right? And that's what you need to pick, right? Are they going to be there? Are they going to have your back when a crisis hits? You got to think for everything.
Yep. Great point. So Len, I'll ask you the next question. There's about 4,000 Medicare Advantage plans throughout the country. And a lot of those plans are associated with, have health plans where they have a significant amount of commercial business as well. And obviously in a perfect world, we'd like when people turn 64 and they age in, we'd like to maintain those commercial members as they, move over to Medicare. But we also know that in a lot of instances that doesn't happen. So in your experience, with the plans that you've worked with, why is it often hard to keep commercial members when they age into Medicare? And what are some strategies to make sure that we do keep those folks within the fold?
Yeah, you make a good point. There's a lot of plans that are out there, right? So when you're finally reaching that point, you need to be aware that, so for instance, if you have a plan and they're not letting you know about their Medicare plans, you're not gonna be aware of it, right? You're not gonna be aware of that there's options out there for you. So one of the biggest challenges I think I've seen for some companies is that they get in their own way, right? You don't have the commercial side of the business talking to the government program side of the business, right? Or they don't want to help them out. So maybe commercial worries that the Medicare team can mess up some of their deals. They don't want them talking to their customers, right? So there's concern about that, poaching. Maybe which is not true. Maybe there's not an incentive, right, to have that happen, right? So getting a strong incentive, having a shared goal in these organizations could help, right? And I haven't seen, anybody do it really well, right? But we do know what you're up against is someone like United, right? AARP, right? AARP is reaching out to you when you're 50, telling you about what options are out there, being the United option, right? So that's, if you don't get your act together, you're going against that, and you're not going to have a lot of success.
Okay, great points. Anybody want to add to that? It does seem with how important the Medicare Advantage member is to the profitability, livelihood of health plans, it seems crazy sometimes, but we just know it's a practical matter that sometimes we work in silos and things don't happen. The left hand's not always talking to the right hand. But anybody else want to talk about that challenge of how we port people from commercial to the Medicare side of the business?
I think this may be similar to what Len was saying, but we see with individual plan members, they have a greater propensity to stick with the brand that they have when they move to Medicare Advantage. And there's a hypothesis that's because they've been shopping all along, because it's different when you're an employer sponsored plan. You have limited choice or no choice. But when you're an individual and you're paying that premium, you're shopping every year. So is there an opportunity to work through the commercial team to get some tools, especially into your large accounts, to give an experience that can simulate or almost bypass a shopping experience, so that we can prevent the consumer from feeling the need that, hey, I'm entering for the first time, I need to look at all my options. How can we arm them and aid the employers to guide that pathway?
Yep. And I think, go ahead, Adam.
I'd add to that. I think, when you're on the commercial side and you're using employer-sponsored coverage, you trust that the company has vetted and done the research and the legwork to look into different plans and find the right one that they think serves their employee base. And, finding Medicare plans is not easy. It's confusing. It's hard. It's overwhelming. So there's this propensity to want to just say, oh, I'll just go with the same provider that I have through my employer because they've done that heavy lifting and I trust that they've done it better than I can do it as an individual.
Yep. And I think, we're going to have a nice case study this year on this coordination with plans that have both ACA plans and Medicaid, with Medicaid redetermination. And we'll see how that works as far as coordination, because obviously that's a big opportunity for plans in this coming year. So the next question I'm going to pose to you, Adam, we talked about this the other day about how different the 64-year-old is, even from, say, a decade ago. And I think either you brought this up or somebody brought this up, that Kevin Bacon, for example, is 64 years old. So Kevin, we saw him on Super Bowl ads, you know, pushing electric cars, and he's not somebody we think of as being 64. And there's also this subsegment of baby boomers called Generation Jones, which, you know, we're trying to make sure that we understand to be effective Medicare marketers. Can you talk a little bit about kind of the current 64-year-old makeup and this whole idea of Generation Jones and how that plays into how we successfully market to those folks?
Sure. Let's start by defining Generation Jones, just so we're all on the same page here. You know, what was once considered one large segment known as baby boomers should really be cut into two segments. There's the early boomers, those born between 1946 and 1954. And then there's Generation Jones, those born from 1954 to 1964. So early boomers are between, you know, 69 and 77. And Gen Jones are 59 to 69-year-olds. So certainly the opportunity to attract Gen Jones, those turning 65 through 69, is greater than their earlier boomer counterparts. You know, Gen Jones are new or newer to Medicare, so they're more prone to switch, I'd say, as they right-size their care and coverage and they get more knowledgeable in the space. You know, Gen Jones tends to have a what's in it for me mindset. They value personal interaction, immediate gratification, and they have a preference for instant communications. You know, these folks they're pragmatic, practical, they're solutions oriented. And they tend to be a little bit more skeptical than their early boomer counterparts. You know, they like pithy, kind of to the point ads. And I'd say when it comes to technology that they're known for being early adopters of technology. They, after all, were the first generation to actually grow up with TV in the home. And they were the first to use personal computers and the internet at home and at work. So they're tech savvy and they're definitely open to digital forms of communications. And I'd say, you know, where early boomers use social media to keep in touch with friends and family, Gen Jones also uses it for things like expanding their network and finding a new job. You know, Facebook is definitely still their social media of choice. And I think YouTube has become more interesting recently too. And then when you compare to the early boomers, Gen Jones are more likely to consume media through digital channels like podcasts, streaming services, and online news. So those channels might be a consideration as well.
All great insights, Adam. Thank you. I also read that they kind of desire to live with the freedom that they maybe didn't have when they got right out of college because of, you know, environmental factors or factors around the economy, but all important insights. Anything you guys want to add to that, Len or Michelle?
Yeah, when Adam was describing that, right? So I'm not the biggest fan of Part B givebacks. Maybe it's Joe Namath, post-traumatic stress disorder with him, right? But what it does call out though when he's describing that consumer is that if you don't have that as part of your portfolio, you might want to really consider Part B giveback because they like, probably the way he's describing it, they like to control their own money, right? They want to make their own. They might not need some of these supplemental benefits, right? So they might want to just get their money back and spend it the way they want. So things that you want to consider, right? And as we're talking about that period of people who are aging in, right? You want to make sure that you're giving them what they're looking for, right? So options, right? Optionality, right? These are important things.
Great. So I'm going to move on to the next question, and it's about the media landscape. And obviously it's all tied into the big soup of the issues we've been talking about. But in this day and age, we see it with TV, we see more and more cord cutting, we see more and more use of streaming service. Internet, you know, usage is obviously changing. I think I saw a statistic where seniors on average each day use social media. 80% of seniors use it every single day. So Michelle, I know you're not a media expert, but you work in this every day with our media folks and with our plans. Do you want to talk a little bit about the changing media landscape and how do we effectively establish the right media mix for our Medicare Advantage plans?
Sure. So I'll take the second half of your question first, and our approach to determining what's the best way to go to market to achieve your goal. So we take a quantitative approach, and there's 4 overarching kind of fundamental inputs that we start with. The first is obviously, what is your growth goal? How many members do we need to acquire in AEP or whatever the campaign or time frame is? What's the budget that we have to do it? What's the strength of your brand? What lift are we going to get from your brand in terms of lead gen or helping to increase the conversion rates to get to the enrollment goal? And then the fourth is looking at the media consumption habits, how they're changing, what are the most utilized, and also what's been the most recent performance from those channels. So we work with a couple of calculators, and the first step is working with your budget to determine what's the right breakout of awareness or preference building versus demand gen. And typically, I would say for a lot of our clients, that does skew to the demand gen during AEP. But especially if you're a new brand or it's a new product and you really have a competitive advantage, we may skew a little bit more to the awareness level. Then the next step in our calculators, our analysis, is looking at what's the right spend in each channel. So to evaluate that, we're looking at lead volume so that you're going to maintain that funnel health and to achieve your goals. What is the output in terms of volume of conversion, and how cost efficiently can we do it? So that's really the overarching approach to how we plan. The other component is what you touched on, some of the key elements of the shifting landscape. So, well, direct mail, and we may talk about that later, has been a workhorse. TV has been a big part of the mix for a lot of plans. And we're gaining some freedom there with the cord cutting that's happening. So now we're not reliant on a broad-based broadcast buy. Now we have the tools to be very targeted with connected TV, over-the-top TV, other video, digital channels. So there's some cost efficiency and specificity that we can achieve there. And also looking at the role of the different channels, digital channels, how we use them. And we might touch on that a little bit later and what that means for what experiences you have to develop on the landing page and on your site.
Okay, great. Helpful. And you mentioned direct mail, which obviously has been a workhorse, in Medicare marketing over the years. But we know the role of direct mail is changing. It's still important. I think as far as a shopping prompt, I think it's number 2 after the ANOC letter in importance. But we also knew towards, when COVID happened, it changed direct mail because people were working from home, and paper costs went up and lead times for paper went up, and, people worried about going to the mailbox and all that. So talk to me a little bit, and hopefully everybody chimes in on this one, but a little bit more on the changing role of DM in the mix, how we use it. And I'll just open it up. Michelle, do you want to start?
Sure. So yes, direct mail is still a big part of the media mix, especially in AEP. It's a large volume lead driver. It also, from a first touch attribution approach, has a really strong conversion rate, especially compared to some of the other media channels. So it's not going away, but those pressures that you talked about, that it's getting ever so costly. We're seeing like 20% a year increase, and we have to make the decisions about quantity so early. So locking in that paper buy in April limits your flexibility a little bit in the planning. So there's a desire to be ever smarter about who are we going after, who are the most likely prospects, how do we cut the waste out. So continuing to innovate on the modeling and the list strategy. It's also driving and aligning with to direct or to digital channels. That media consumption habit is growing. The challenge that we see there, that it can't instantly replace the direct mail, is direct mail will trigger a phone call. And a lot of clients, their Salesforce is an inbound team. So they're awesome at receiving that phone call and doing the needs assessment and converting it. But it's a really different experience and skill set to follow up on a form fill. So we're putting more focus on developing the right landing page experiences that are going to drive a phone response to a digital medium. We're also looking at, with this younger generation that's used to being independent and shopping and making even financial decisions by themselves online, how do we support that self-serve mentality? So what are the tools, product comparison tools? Is it starting to think about chatbots so we can get complex questions answered quickly and really continue to feed a pleasant experience and a sense of confidence? So I think direct mail we need to be smart about how we build out our full digital experiences and make the most of it while we can. But it does seem like we're on the point of maybe moving away from traditional and going deeper into digital.
Great. Adam, Len, anything you want to add there?
I think, Michelle, you hit on all the right points there. And I would just say, trying to coordinate your offline and online presence is important as well. Think of QR codes, for example. Pre-pandemic, QR codes, especially among seniors, didn't even exist, right? They wouldn't have known what it is, what to do with it.
But they were seen
But
as a
now you
failure.
go to a
Yeah.
restaurant and you get your phone out and you scan the QR code just to be able to read the menu and figure out what you want to eat. So I think there's ways to link the two off and online tactics together. And I agree. I think, knowing that, for example, Jen Jones, like I mentioned earlier, they want that personal interaction. They want that instant gratification. Chatbot or even inbound phone calls is a really smart way to go about delivering that for them.
Yeah, the only thing I'll add is that I don't think direct mail is going away anytime soon. I know everybody's going through that digital, everybody's trying to fine tune their digital marketing campaigns, right? And do better with that. And I get that, and it needs to continue, but digital still, as you said, Michelle, it makes the phone, or direct mail makes the phone rings. And I work a lot with provider groups, and our direct mail campaigns are always the ones that have the most impact, right? So don't see it turning yet. I welcome all the digital things that are helping us. We do a lot of email and our direct mail campaigns kind of like are integrated where you're reaching out to the same customers in multiple ways, and that helps too, right? So the different types of touches in different ways to that consumer, that's part of the campaign development, right? So Jim, I'm going to pass it back to you because I see some chats coming up.
We had a question on that. How are you incorporating ChatGPT into your Medicare strategies?
So I will admit we're in the early phases, and it's not so much the new chatbot, I'm going to get the acronym GPT, but it's just bringing in that tool that you see in other consumer online experiences of the chatbot, where you have a question, you're either tried to find it on the site and gotten frustrated, or it's after hours and you can't reach someone. So it's a technology to input a question and drive a relevant answer and a good consumer experience. We're on the forefront of that. This is early in these days.
Okay, next to Len, supplemental benefits continue to be an important differentiator, obviously, for consumers when they're selecting an MA plan. Which supplemental benefits do you feel are most important, and why? I mean, we know that with vision, hearing, fitness, dental, almost everybody has that, but what, and we also know too that not everything is created equal. All dental programs are not created equal, and there's new kind of regulations around that as far as what spending is being dedicated to those type of benefits. But Len, just shed some light on supplemental benefits and what's most important these days.
So obviously, I love the creativity that's been happening with supplemental benefits over the last few years, right? So just even the companion support stuff that's been helping with the social isolation, the grocery benefits, delivered meals, acupuncture, massage therapy. These are all great. It's great stuff. Yeah, the thing that's been popping lately has been the OTC or smart cards, right? It's been kind of like one of those top 5 comparison tools for the consumers as they're making their decision, the tipping point, maybe, if you will. They like that flexibility. The allowance size is a big comparison. Which plan has the most allowance that I'm going to go with? End of the day, though, I think you make a great point, Jim. At the end of the day, those supplemental benefits are great and they're sexy, but you need those core benefits, right? The good dental, the vision, the hearing, that's your offensive line, right? So yeah, they're not sexy, but they're what, and if you looked at the deaf research recently, that dental still pops out, right? And maybe there could be a couple of reasons, right? Well, white dental's very hot right now. Maybe it's, again, COVID, right? Maybe there were a lot of people that stopped going to the dentist during that time, and nobody's in a rush to go back, right? Until they're starting to feel pain. So as we saw during AEP, a lot of the consumers we work with, that's one of the top questions they asked about was dental. And it wasn't just comprehensive, it was routine care. What do you got? What do you got for dental? I want to see the comparisons. So I love the creativity with the new benefits, and I think we should continue with that, right? Coming up with the next big thing, but stay true to what we've been offering and what consumers really expect and want from us.
So I have another question for you, Len, around brokers, and I know that you have some nice experience working with the broker channel. What's the best way to get the most out of your broker channel? And I know part of this is we know that retention rates are much higher when people are put in the right Medicare Advantage plans, and a big part of that is making sure that the people that they interact with are putting them in the right plans, right? So just give me some insights on some of the things that have worked most successfully in your experience in working with brokers.
Well, yeah, and I'll go into the retention a little bit too. Retention is incredibly important, right? So everybody talks about having that lifetime value of your members, right? So everybody wants that in Medicare, right? Great retention rates equals long-term profitability, right? So, you know, when consumers are shopping, you want to make sure they're getting, you know, what they're asking for. Besides what I was talking about before, the supplementals, it's the doctors, the drugs, the dollars. You know, we joke around, it's the 3 Ds, right? So you want to make sure you have them in the right you have the right network of doctors, the right formulary, the right tiers for the right drugs. $0 used to be the mainstay. Everybody wanted the $0 plans. Now everybody has the $0 plan, so it's not a differentiator, right? Low MOOP, right? Maximum out of pocket. You want to make sure you're getting to that, right? That's critical, right? Lower no copays. You know, out of the pocket. You know, you're talking earlier, Michelle and Adam, about the cost of Medicare, why you know, consumers, it's on their mind all the time, right? So and I think right now too, finding out what consumers want is really important, right? Now's the time. It's, you know, you're fresh off AEP, open enrollment, right? It's surveys, focus groups, you know, stuff that you should be doing yourselves to your own members, right? Listening to the calls every day, right? Listen, and then listen some more, and then use all that when you're developing your products for 2024, right? So brokers, right, they can help with that, right? So and look, they're not always the easiest to work with, right? And I can say that because, you know, I play that role, but some of them are great, but some of them, you know, can be a pain, but they want what you want, and that's a bigger book of business, right? And keep them informed, right? You want to make sure your top brokers are finding out about your products or issues that you might have with your products from you and not from the rumors on the street or from customers calling them, right? Be as transparent as possible. But remember, brokers have a lot of friends, right? And so when I say that, like, you know, that they might be talking to Aetna, and Aetna is their best friend today, and then Humana is the best friend the next day. So they're going to share, but beware, right? They're gonna, you know, you want to keep them in your loop and make them part of your team, but just remember that, you know, they're also working with everybody else. I saw during AEP there was a few issues with the carriers with the smart cards, right? Rolling them out. Vendors were having issues; they weren't coming out on time, and there was a lot of challenges there. And it was a couple companies that had the same problem, right? But what I didn't see happen was those carriers going to the brokers right away, because they're getting the calls every day from the customers, giving them the talking points, the FAQs, the information to help them retain those members, because it is open enrollment. And if the members didn't like what they were dealing with, they were getting them to move along. So, and I know I'm being a little long-winded, but I'll sum it up real quick. To get the brokers engaged, you know, marketing dollars definitely helps. If you don't have that to share, do regular meeting cadence, keep them involved. During AEP, you can let them have some of your meetings, share some of your leads, not the twice baked potato that's been worked by everybody on your team, and then give them the leads. No, give them something fresh. I mean, I think, making them feel like they're important and valued is important. One of the things you can do too is they're creative, right? They're a creative group of people. They know your customers really well. Do agency or broker focus groups, right? Bring them together and let them share some great information with you. Listen to them, right? They got something to say.
All great ideas. And around the listening front, we work with a lot of plans too that have broker advisory boards, and that's just to make sure that you have a regular time where you get together to develop relationships and also do that whole listening piece too. So all great stuff. And as marketers, simple rules, and you think it would be simple to be simple, but it's not. Especially when you have layers of people that approve things, and everybody wants, just like a website, they want to put their little pieces in all your marketing pieces. But Michelle, why is it so important to be simple in your communications, and how do you do that?
Sure. So I think there's a few factors driving greater importance for clear and simple communications. One, I think we all know about the fact is we all age. We rely on type 1 thinking more, which is that intuitive rule of thumb, not wanting a spreadsheet analysis, a complex problem. Two, coming out of COVID, more things have been offloaded onto the consumer. Like, going to the doctor, it used to be you just show up in the doctor's. Now I'm filling out a couple of forms online before I show up at the doctor's office, or the grocery store, I'm checking myself out. So having a clear and simple communication is not adding to their burden. It's something, like I said, simple, it's engaging, it's going to get their attention. We also talked about this younger audience and being more digitally engaged. And that's an environment where scanning and visual communication has been even stronger. So there's an expectation. Our attention spans are getting shorter and shorter. So simplicity is important for that factor. The other reason, Len touched on doctors, drugs, and dental. So while there's variances in those factors between companies, everybody's talking about the same three things. So if you are simple, you can carve out a different way that will be noticeable to talk about those elements and get attention. The third area is in your calls to action. We want to have some choice, so that we're appealing to where the consumer is comfortable and is more likely to respond. But we don't want to have so many that it's analysis paralysis, or there's a 3-step process to respond. So simplicity is super important. It's not easy to do. However, I think one of the things that we have to help our fellow marketers is remember, one communication doesn't have to do all the work. You have a direct mail piece, you have, a series of social ads, you have email, you have TV. So use certain pieces to tell the story. And when the consumer has all the touch points, it's an additive effect to a compelling reason to raise their hand or to complete enrollment with you.
We have
too much. There's no action taken. Sorry, Jim.
That's okay. We have one of our senior folks that you guys all know, Steve Lynch, who is our lead writer, and he says people hate to read. So I think just using those visuals in the best way possible, it seems like a intuitive thing to do, but I think a lot of health plans don't do that. So we just have a few more minutes, but I had a couple more questions. Adam, I know folks have marketed 5-star, 4-star, et cetera, plans on this call. I know you've spent some time marketing 5-star plans, and we know in 2023 we saw less and less. We saw the average plan rating go down, and a lot of that has to do in how they score it and cap scores, and some things it's tough to control. But from your perspective, Adam, what are the key things in kind of trying to take advantage of that 5-star status and communicate that to consumers, what the benefit is? Because a lot of them don't understand it, so.
Yeah, I think as MA marketers, one of the key challenges we face is how do you convince everybody else's members to shop and ultimately choose you while keeping your member about shopping, right? Because you want to retain as many of them as possible. So one of the benefits I'd say of a 5-star rating from a marketing perspective is the ability to influence and create a need to shop and to drive that switching behavior when other plans are actually restricted from doing so. Of course, the thing about star ratings is that most plans don't go around touting their star ratings because they either aren't, top rated in the market, or they don't have a rating worthy of doing so. So when I worked on a 5-star plan, I look to leverage that as a key differentiator, and we screamed it from the rooftops. I wanted to create curiosity and influence people into a shopper mentality, encouraging them to find out, what was their plan's star rating and why don't they know what that is, and then compare it to my plan's best in class 5-star rating. And in fact, I partnered with Merge, and we developed a 5-star campaign that included a series of TV and digital ads that basically leveraged simple, fictitious, humorous kind of everyday analogies to help people understand the rating system, right? That gave the viewer a reason to pause, to reassess, and to rethink their coverage. So one of the spots, for example, and if I butcher this, I apologize to all the team members at Merge who helped make this so great. So help me here. But we showed, I think it was like a 3.5-star review for a place called the Leaky Lodge, right? And you saw a visual of the lodge, and you heard this voice come in, and we saw the review on the screen, and the voice said something to the effect of, this place is okay so long as it doesn't rain. Right. And then the hero VO, representative of the brand, comes in and says something like, when it comes to your health plan, just okay isn't okay. You need to choose the only 5-star rated plan available. And I hope you get the gist from that description. I'm sure that the folks at Merge would be able to share that creative with you if you're interested. But anyway, that campaign not only lifted brand metrics, but it also drove a nice spike in lead volume and sales for us.
Okay, great. Thanks for the
Jim, I'll
the
just
plug.
jump in. There was
Yeah,
a
sure.
question about the 5 stars and do consumers understand it? And no, I don't think they fully understand the star rating. And as marketers, our job isn't to say these are the 38 criteria and how they use them and instead is to translate what is the experience that they'll have from a 5-star. I think we also, in executing 5-star campaigns, have to give them a reason to trust and believe the 5-star or the star system in this day and age of bogus rankings and bought for endorsements. So you do have to trigger that, hey, 5-star is an easy way to evaluate a plan and gain trust, and back that up with why it's a meaningful evaluation and is trustworthy.
Great. Len, anything you want to add?
Yeah, so when you're trying to compete against a 5-star plan, right? So, 5 stars are not like the Death Star, right? They don't have a design flaw, right? They're really good. They're 5-star for a reason, but they're not perfect. So when you're trying to market against them, you got to find that one thing that you're better at and just highlight that and push that home.
Yeah.
Great. Well, I'm going to try to be cognizant of the time that we promise people, but I thought this was interesting. I love talking to you guys. I love hearing your insights. This is really helpful. I hope this was instructive to the people who are tuning in. I think there was a lot of good stuff on how do we approach the new 64-year-old and how they're acting these days, the specific channels we talked about, how do we kind of relook at our approach to direct mail and the changing landscape of media that Michelle talked about. The approaches with broker, I thought you brought up a lot of good points, Len, and that's important. And I think, why simple is important and how we approach 5 stars or don't approach 5 stars. I think all that was really helpful. So thanks a lot for your participation today. Thanks for the folks that tuned in. Selfless plug, if you do have any questions for Merge or would like to talk to us about any of your communication needs, we'd be glad to talk to you. But again, thanks for everybody, and good luck this year. Okay.
Thank
Take
you.
care. Okay. Bye-bye.